Let's bring in Dr. Marc Siegel. Great to see you, Doc. Have you seen any evidence that Donald Trump might have dementia?
Well, Ashley, good morning. Let's start with the idea that I've never seen Nancy Pelosi with a stethoscope, let alone a cognitive test or an ability to diagnose anyone. And I don't know what health professionals she's talking about, because again, you know, we're not former President Trump's doctor. But I'll point this out. He seems to do a lot without a teleprompter. He speaks spontaneously. We sat riveted and watched him at that Philadelphia rally last week. I was on the set of the big weekend show, and we were riveted at the way his thoughts did go together. And when I interviewed him 4 years ago, I mean, he was sharp as a tack then, and again, didn't use any notes, didn't have the questions in advance. So I think that even though it's not a cognitive test, actually acting extemporaneously goes against the idea of any cognitive impairment. I think the issue, you know, by the way, on the other side with President Biden isn't only the 90-minute debate. It's that there's been other signs of not keeping thoughts together. And we can't blame everything on a cold medication, by the way. So I think the idea of being like schoolyard children where you said, oh, you think our guy's demented? Well, your guy's demented. I mean, it's like high school, isn't it?
It really is, and it's pretty rich that Nancy Pelosi accuses the media of failing to cover the dementia being suffered by Donald Trump, in her mind, when the mainstream media has been protecting Joe Biden for a long time, but not anymore after that debate. But I want to move on, Doc. I want to talk about a study that found taking multivitamins each day won't actually make you live longer. The study says there are no differences in mortality. So the question becomes, I guess, what's the point of taking multivitamins?
Ouch, ouch. This is the Business Channel, and that's a multi-billion-dollar industry we're talking about. But
yes.
The NIH looked at over 400,000 U.S. adults over 20 years and found no survival advantage. Now, that doesn't mean vitamins don't help you, by the way. I think my message here, and it's the way I've always practiced medicine, is I go one by one. I like vitamin B complex for a lot of different things, including migraines and memory. Yes, I think it helps with memory, by the way. I've told Stuart that on our weekly Alzheimer's segment here. Helps memory, memo to the White House. And I also like vitamin D3 a lot, because I think it's almost like a hormone, the way vitamin D works. But you got to test it. You got to check levels to see if you're getting enough naturally or in your foods. The key here is that a lot of the vitamins are in our food, like vitamin C. You get a lot of this in your food, so you don't have to automatically take a multivitamin and say, I'm missing this, because most likely you're getting most of it. So I test for the vitamins that I'm suspicious about, and then I look at it per patient.
Got 1 minute left. I want to get to this. Another study found that ultra-processed foods are linked with a higher risk of death. I would say Captain Obvious, but some doctors say the foods can still fit into a healthy diet. I mean, or should they be cut out completely?
Well, nobody's going to listen to us. I mean, your producer said, look, I'm in my 20s, and what do you think I did over the weekend? I'm not mentioning his name. But look, over 500,000 people were studied, and the point here isn't the ultra-processed foods, because you're right. We already know that they're associated with colon cancer. They're associated with GI cancers.
Right.
They're associated with heart disease. But the real issue is, what are you eating instead? I think you could have ultra-processed foods, a small amount in your diet, providing you're having a healthy diet. Mediterranean diet, we always say here on the show. Fruits, vegetables, fish. Yeah. And a glass of wine occasionally. That's what's good for you. Don't overdo the ultra-processed foods. That's the message.
We hear that message loud and clear. Dr. Siegel, thank you so much as always.